Childbirth is one of the most dangerous experiences for Black childbearing bodies in the United States. Over a century ago, Dr. Rebecca Lee Crumpler observed and dedicated her life to changing this reality, accepting this challenge as a labor of love. I'm Dr. Gunga Bey, a knowledge producer and epidemiologist at the University of North Carolina at Chapel Hill. Epidemiology is a science focused on understanding not only who gets sick or stays healthy, but why and how these patterns emerge across individuals, populations, and regions. My epidemiology focuses on connecting the dots between love and health. Today, I shine a light on Dr. Rebecca Lee Crumpler. In 1864, Dr. Crumpler earned her MD and became the first Black woman physician in the United States. You know what else was going on in 1864? A whole lot of racism and a whole lot of sexism. So the degree alone is a tremendous feat. But what distinguishes Dr. Crumpler as a public health pioneer and social justice warrior was her work to address an epidemic of poor maternal and infant health outcomes. This was the work that she committed herself to following the Civil War. Her groundbreaking piece, published in 1883 entitled A Book of Medical Disclosures in 2 parts, was one of the first widely circulated medical texts written by a woman and one of the earliest works documenting America's Black maternal health crisis. It's been over 140 years since Dr. Crumpler's publication, y'all, and today, Black women still die of childbirth-related complications 3 to 4 times more frequently than other ethno-racial groups. Research shows that because of racism and sexism and their intersection, Black women bear children in bodies uniquely burdened by stress. Age-related pregnancy risks increase among Black women 5 to 7 years earlier than among white women. Add that to healthcare providers being much more likely to overlook Black women's pregnancy concerns and risks, and you have 150 years of preventable maternal and infant deaths. Then, as now, Dr. Crumpler recognized that Black people's poorer health outcomes were largely due to 3 major barriers: systematic dehumanization, medical abuse and neglect, and criminalization. Her approach of treating patients as deserving, capable, intelligent human beings went a long way to mitigate distrust of medical establishments within the Black community. Alongside her personal philosophy of practicing with compassion, Dr. Crumpler worked against many barriers to advocate for patient-centered care and broader health systems. Her work also inspired Black people to take more control of our own health through education and community-based initiatives. Above all else, Dr. Crumpler is a great example of how love, meaning a commitment to strive for the well-being of others as we strive for our own well-being, is a powerful public health tool. In addition to exemplifying her extensive medical expertise, Dr. Crumpler's legacy shows us that recognizing the innate value in ourselves and others and acting on those beliefs in spite of a society that tells us otherwise can make a measurable impact on all of our health. Thanks for tuning in to this brief history of Dr. Rebecca Lee Crumpler. I hope y'all learned something. This is just the first in my Black History Month series, What's Love Got to Do with Health, where I'll spotlight Black pioneers who exemplified love in their efforts to improve the health of the public. It's so fitting that Valentine's Day falls within Black History Month. When you think about it, throughout American history, Black people have been one of the most loving groups of people, fighting constantly under duress for the rights and upliftment of all people, not just other Black people, in a country that has been structured on our very subjugation. If that's not love, I don't know what is. So stay tuned, y'all, for part 2. And as always, I'm out here doing what I can to help us all know better, do better, love better, and live healthier.